Yep.
Here we go, PJ live. Hey, PJ Brooks, good to see you, my friend. Thank you for joining me for the first ever TBV live video conference. I've had a lot of people on the team been asking me to do this since this whole lockdown began, and I've been very reluctant to it. Recently, I got invited on a couple of shows. I figured, why not join the crowd and start doing this? And who better than to start off with than PJ Brooks? So for those,
don't make me blush.
So for the people that don't know, PJ is, he just got a new title. PJ is the Chief Clinical Services Officer for First Step Sarasota. Congratulations on the new promotion, PJ.
Well, thank you. You know, it's an opportunity with us taking over coastal behavioral health care and bringing them under our fold. And we went from about 190 employee organization to we're close to 400 now. Bringing behavioral health services together, both mental health and substance abuse, in an integrated fashion, I think it's where we need to be. It'll serve the community well, and I think that it's the right thing to do at the right time.
Yeah, that's awesome. So that puts First Step really in a position of controlling all mental health and substance abuse on a county level for Sarasota.
Yeah, well, I think what it provides us is we have the full continuum. You know, yeah. That's the nice thing about it, from prevention on both ends, mental health, mental wellness, to substance abuse prevention, all the way through the acute care for both crisis stabilization and detoxification. Yeah. And our residentials in between. It's I think it's time, and I think we've got some work to do, but I think I'm excited for Sarasota.
Yeah, Sarasota is really progressive. I'm up in Boston now, and Boston is very progressive in terms of the recovery community. But in Florida, I think Sarasota is the leader in terms of the rest of the state for things in the recovery space. I mean, I love what they do down there. You and I have been friends for a long time. And it seems through, Tom Knight and the Recovery Pod and you and a bunch of other people that Sarasota seems to be on the leading edge of a lot of stuff that maybe starts off in Massachusetts, and then when it enters Florida, it starts off in Sarasota, and then it spreads to the rest of the state, which is really cool.
Yeah, I'm proud of how our community has at the local level. We have some challenges at the state level that and it's mostly because we're so restrictive in the amount of funding available statewide. But our county government has been very progressive, even in a very predominantly Republican community. They've recognized the value of substance abuse and mental health services, and they look at it from a humanitarian purpose, but also from a fiscal purpose, because they recognize that individuals and families, if they're keeping in jail, there's costs to those things, and money on the front end saves on the back end.
It's a tough message to get people to hear, though. As you and I have been doing this for a long time. Talk a little bit about how long have you been at First Step? How'd you get involved in the recovery world? I mean, you're one of my first go-to people in Sarasota whenever I have a recovery issue. And when you've been doing it longer than me, I came at it from a different perspective. I just burned my life to the ground with alcohol and got into long-term recovery. You didn't pay that high of a price. Why don't you talk about how you got involved?
Well, I got into I've been in and around the recovering community since I was 12. My folks both got sober when I was 12. I grew up in the rooms. I sat in the back of the rooms while they're in meetings. As a teenager, and they put me in counseling and did all those things. They were smart enough to recognize that just getting sober wasn't going to be good enough to fix the idiot you see in front of the camera. So it became, just kind of where my life led me. I started off in psychology and worked in, my first job was actually intended to be temporary in the recovering field with an organization called Storefront Centers for Counseling, which ultimately became Coastal Behavioral Health Care. Oh, yeah. And that's in the late 80s, and I've been working in it ever since. It works for me. I feel like I serve it well. I'm very much mission driven, and this is where I grew up. So the folks that I work with are the people that I played ball with. Their kids played ball with my kids. And it's the way I look at it. That this is it ain't about getting rich. It's really about caring for this community. And my dad was a cop too, so growing up in around law enforcement and being involved with law enforcement right now in Sarasota County that looks at the need for treatment, law enforcement being, that is just so powerful that we're all walking in lockstep to recognize the need for the services.
Yeah, that's awesome. No, you're
So, as you ask, I've been in the field 33 years. It's a long damn time. I've been at First Step for 22.
wow.
And part-time starting in 98 and full-time in 2001. I've kind of heck, my whole professional and my whole life, other than when I was 2, I came to Sarasota at the age of 2 and I've been here ever since.
Yeah, that's awesome, and you do a great job. I mean, you're one of the good, the real solid good guys. I mean that, that you anytime there's an issue in Sarasota, you're one of the first names that comes up in the recovery space. Who do you call? Give PJ a call. If PJ can't solve it, PJ can find somebody to help solve it. And not a lot of people. There's not a lot of people on that short list when we have the problems, especially coming out of just the nonsense that we went through over the last 5, 6, 7 years with the overdose deaths and the opiate epidemic and all of the related nonsense of that. Right? It was.
And what's frustrating right now is we're starting to head back into it a bit. I've been tracking, as I do on a regular basis, I work with law enforcement and EMS, and there's a whole group of us that really try to track where we are with overdoses and all that. And since January, we're starting to see a major increase. In fact, right now through April, we're on pace to be the second highest number of overdoses since 2013 in terms of, by the year. Death-wise, we are well over double, on pace for double of last year. And what has not helped is the having to shelter in place, stay in place with the COVID epidemic. We've got people who have had stable recoveries and then have fallen off because they're not connected to their fellowship, to their brothers and sisters in the recovering community as they need to be. And it's so frustrating right now.
Yeah, so there's so much in that sentence that you just spoke to. So I don't do any deep clinical research, but I do keep track of what's going on in my own life. And I can tell you that I think it was last Thursday or Friday, I got notification of the 14th person that I knew had overdosed and died in 2 months. So during this shutdown, 14 people I knew overdosed and died. Now, I can't tell you, maybe a year prior, I went through a period of time where that was very common.
Yes.
A couple of weeks back in 2011 and 12 and 13, it was very, very common. I'm getting calls from the emergency room. Your friend's down here. Do you know this kid? Do you know that kid? But then it stopped. It stopped for a long time. And watching this thing kind of pop off again, really frustrating. And when you talk about the meeting rooms and the recovery, when you take away the most important thing we teach people in recovery is you have to have community. Mm-hmm. Right? You have to do it with other people. And
it's hard to get a hug through Zoom.
Holy crap,
Yeah,
so difficult. And just on a personal level, I can tell you that I watched my own addiction manifest itself, not through drinking, thankfully. I haven't had a thought of a drink in a long time. But when they, shut everything down and this lockdown began, it threw out my routine. So my routine is meetings at the gym, two things that they really helped me out. They closed them both down. So what do? I didn't go right to the Zoom meetings. I wasn't quick to adopt that. What did I do? I sat at home. I kind of got depressed. I stopped talking to people. And now the gym's closed. So I went the opposite end of the spectrum. There was one night that I sat around and I ate a dozen chocolate Entenmann's donuts with 4 Cokes at one sitting. Right? And that's the addict in me. I was trying to change the way I felt. I was uncomfortable. And I was not willing to change my routine to exercise outside of the gym or to get my fellowship outside of that normal face-to-face meeting.
There's a level of stubbornness that we have that, this has required flexibility to the nth degree. Even with our staff, our clinical staff, we've got about 60 outpatient clinicians in our outpatient system. And we had to go from face-to-face services to telehealth in 5 days.
Yeah.
Now, here's the thing. Just getting them operationalized was like herding cats. We could not even prepare our clients for it because, it wasn't like, okay, well, let's sit down and we'll train you. We can't because we're spacing. We weren't able to do that. So, but with that said, this is what's interesting with the telehealth services. We looked at the data pre-COVID from January 1st this year to March 14th, because March 15th was the Sentinel Day when everybody said go home. Okay, as of March 15th through May 18th, the our no-show rate prior to COVID was 27%, so 72% showed. After COVID, with the telehealth, our no-show rate's 18%. And
Wow.
we're with an 82% show rate. Now, here's why. Most of our clients, in some way, because they're involved in the legal system, often have lost driver's licenses. They have to rely on other people. They don't have to travel. Or if they're working, getting off work and all that, we've been able to do sessions at lunch times, and our staff have been so flexible and accommodating of the clients to try to be flexible for them. And even, well, I'll tell you where it's really telling is with our psychiatric services, because a lot of our clients who are on psychiatric medications really have some struggles with coming in and doing what they need. And this has allowed them to be able to get the services that they need without having to figure out which bus to get on and all of that.
So if I hear you right, the telehealth is improving recovery compliance?
Well, you know what? I think here's the thing. We don't know if everybody's clean that's on the call,
No, but you know what? But at least they're engaged, right? And it doesn't matter. One of the things.
The only people we can't treat are the people that don't show. Here's the thing. This gets us to where this maintains what we have in place. This helps us keep contact with clients. Now, the sad part is we have clients we are losing that have fallen off, and then and are. I'm worried about deaths that we don't know about. Right. To be honest with you. Now, as we look at it and we sort through it, the key will be when we're able to start coming back to face, that this resource, this tool needs to stay active, and we need to advocate at the federal, state, and local level for the way they relax the rules, HIPAA requirements, and all of that to allow this telehealth and telephonic services to occur. We need to make sure that stays one of the tools, because here's what it is. We actually found out there are clients who do better with this. Mm-hmm. And you know what? I'm old fashioned. I'm an old guy. I don't even have Facebook. But what I've realized is
I'm going to hang up if you don't even have Facebook. Then we're done.
Yeah, I'm going to hang up. Go ahead. But when we talk about these phones, these are not. They're not a tool, they're an appendage now.
Right, absolutely.
Especially the folks that are younger than us, this is where they are. So this is very comfortable to them. And actually, their engagement's a little better because what they're doing is they are more comfortable because they're in their own home environment.
Yeah.
Just have to tell them put on a shirt.
Yeah. No, so I like it. And I think you're right on track. I think that, one of the things that we did with TBV, I know you and I spoke, but we added in this type of a component, a video component, to help probation officers and case managers meet with their client face-to-face this way instead of just a simple phone call, because you can determine a lot through a face-to-face Zoom call, right? How's my client doing? Are the eyes glassy? What does the environment look like? Is the speech slurred? So we can step up or step down that level of care based on, these kind of interactions. But then, excuse me, once I guess the world returns to normal, I really believe the meeting attendance, by default, I think what we're going through is a case study to prove that meeting attendance works for recovery, because so many meetings have been taken away. And I know, just forget about the overdose deaths, which are very problematic. Like I said, I've had 14 that I know of in my world, but the amount of the relapse rate is through the roof. I've been going to some outside meetings in Sarasota, none up here yet in Boston. But the people that are coming in and grabbing white chips every stinking day, it's tough. It's really tough. You just don't get that same. while you may get that same interaction with a clinician, I don't think you get that same interaction with the recovery community over the telephone that you do when
The
you're
energy
sitting out
isn't
at the
there. I mean,
yeah,
there's a, I mean, yes, I'm a clinician, but there's a spiritual energy that connectedness, that when I say fellowship, it's beyond, hey, buddy, this is, hey, brother, hey, sister, this is, family. This is, and non-judgmental family.
yeah,
And that's, and I've, part of the reason why we've been involved with you and TBV is that we have in our organization, and me personally, have recognized the true value in the recovering community.
yeah.
That this is a way of keeping your life sane and stable, and being able to dump your shit, for lack of a better way of putting it, out there, and everybody goes, it's okay, we're with you, I'll help you carry it, let's dump it in the buckets and we'll carry it together. So
If you any sponsee I work with, anybody that I try to help, I tell them, if you keep it up here, you will drink from what you keep up here. But if you can speak about it, or if you can write it down, it comes up from here, it gets out, and it loses its power. By taking away those meetings, I can tell you it's very difficult to be able to have that level of communication in a big Zoom AA meeting, as an example, or an NA meeting. It's nearly impossible. They have side chats and side rooms and things like that. But I'll tell you, I've been really searching out the in-person meetings, and there's been quite a few, that we can go to. But unfortunately, there's not a lot of recovery at them. What I've found is going to the in-person meetings, it's much more of the people that are coming back than it is. So I'm there to help, which is great, but I still need help as well. And there's not a lot of people with more time. They've kind of gone away, I guess. I don't know. Tough. What are you seeing? What are you seeing over at the detox? What are you seeing for the drugs? Are the opiates back? Is it the fentanyl, the coke?
You got to understand, part of what we're dealing with is both detox and the CSU, the complexities of, we have to be mindful of people presenting potentially with COVID. So we've had to limit the number of admissions that we can take in, primarily because we got to have adequate space. The space, it's one of those you don't think about. And and I tell you, I really have a lot of respect and I for the staff that are working in both of our facilities, because you hear about nursing in the hospitals, you hear about the nursing home folks that are working. You don't realize that what they're dealing with is a often combative client population that are walking in. They're essential providers, and they're not like someone coming in and you can set up space. These clients are coming in inebriated, under the influence, falling down, or in a psychotic situation where they're not going, oh yes, I'll give you 6 feet. So it's I tip my hat to them. I really give them a lot of credit for marching through this, and you're not hearing about them, and I think that, and I think we should. I think there's a lot of them across the country that are doing the same.
Yeah, you're absolutely right. Spot on. It's kind of funny. It's with this whole disease, I wasn't really, and I don't remain overly concerned about catching the disease. I don't know why. I just don't. I'm not too concerned. And I've been trying to really wrap my head around, why is that? When I have conversations even with my own family and they talk about the number of deaths, and the only thing that I can conclude is that, people like me, people like you, for the last 10 years, we've lived through 70 to 80,000 people a year dying from an overdose. On top of that, 85,000 a year dying from some alcohol-related condition. Right. So we got accustomed, I got accustomed to big numbers, 70,000, 80,000, 90,000 deaths annually. It's the only thing I can wrap my head around as to why this thing, it's not that it doesn't bother me, but it doesn't scare me. What do you think?
Yeah. I think the, what I wrestle with is that it's it's so complicated with the fact that we don't have clear answers and clear guidance. We don't have, so I kind of just, I don't mean blow it off, but I take a bit of what I hear with a grain of salt, only because I feel like in 10 minutes you're going to hear something different from some important figure, and we don't have consistency and continuity. I think that if we would have had everybody in lockstep in agreement about things, I think I would have probably not, I wouldn't say take it more seriously. I'd say just wouldn't question what's being told to me.
Yeah.
I wonder about that. And that's me as a person. I still know what we do in terms of how we're organizationally and how we're operating, and, making sure we're keeping staff safe. And I can tell you emotionally, you got the gamut. You got people who are way over cavalier than me. And then you've got people who are scared to death. And each person has a right to their own experience, but it makes it very challenging to have consistency.
Yeah, it's tough. And I remember I got blown up one night on Facebook. I am on Facebook, and I know you know that. I do a lot of my work. I do a lot of my work on Facebook. But I had bumped into an old friend, a young kid who was out of town and came back 3 years clean. And we were at an outside meeting and took a picture with the four of us together a couple weeks ago on a Saturday night. And I got blown up on Facebook
for
not spacing, no mask, and this and that and the other thing. And I found myself getting very defensive and wanting to fight. I didn't. And I just took a step back. And again, I wrote about it. And I think, again, in my mind, just for me, I know I already have a fatal chronic illness called alcoholism. I have it. I might not catch it. I've already caught it. And I have it. And I have to do certain things to make sure that it doesn't, come back and rear its ugly head. So going to those meetings, part of my solution requires being close to people. It just does, So I didn't have to engage. I didn't have to fight. I didn't have to get into the politics of it. But boy, it didn't feel good. It didn't feel good. And then I come up to Boston, and you'll love this. Florida's kind of normal. I land Monday in Boston. I go to get a sandwich at my local roast beef sandwich shop. I don't have a mask. They won't let me in the door.
Yeah.
Right? Won't even let me in the door. So I had to go in. I had to cover up like this, wrap it around my head. So Massachusetts is still pretty closed down. So I think you guys are lucky down there. Hey, I appreciate you taking the time. Any closing thoughts?
Just that, as we look at where we are, I think that if we were to take a lesson from what's happening with all this, that, I think about TBV and the telehealth services and other, what I would call treatment extenders. I think that we need to recognize that there's some tools that have been, I would say, ratcheted down for the longest time, or made very restrictive on how they can be utilized. Yeah. Those gloves need to stay off. They just need to say, hey, we need every resource and tool available. And because here's what we talk about in our organization and our senior management: what's going to happen when everybody can return with the mental health and substance abuse issues that are going to we're anticipating some level of tsunami to come at us, and we're girding ourselves for that in preparation of having to all hands on deck, emotional and mental health and substance abuse triage. We're anticipating on all levels.
Yeah, and I think that's spot on. And I think one of the things that we can do, and one of the reasons why I want to do this, I think there's going to be a lot of people coming into recovery for the first time when this COVID concludes, that have been drinking too much or using too much at home while they've been cooped up. And to just know that there's always a friendly face out there, right? In Sarasota, there's PJ, there's Chuck, there's thousands of us. In Boston, there's thousands everywhere. There's nothing to be ashamed of. If you need help, reach out. We're all there. We've all been where you are, right? And we do this together.
These are unprecedented and extraordinary circumstances that, it's like when we talk about people in recovery, preparing yourself for there was no way to prepare for this. So I hope people that are struggling and maybe who have relapsed and are really feeling embarrassed or whatever, get over it, because here's why. You know what? Forgive yourself for that. This is something that is unprecedented. Just let's get through this, and then we'll work together to get back on the right path.
That's such great information. So my experience, right, from 1999 to 2008 in AA, my nickname was 90-Day Chuck. I just could not stay sober I got 42 white chips. I relapsed every 90 days, basically, and there was
Make
no
a nice
pain.
necklace.
Yeah. But there was no pandemic. There was no excuse. It was just,
Yeah.
it was my disease was stronger than I was, and I was not ready to stop. So, we've all relapsed. So whatever your condition, if you need help, reach out, man. We're here.
Yep.
Well, PJ,
Chuck, thank you for having me. I appreciate it.
Have a great weekend, and I'll see you when I get back to Sarasota.
Have a great Memorial Day.
Thanks, my friend. Bye-bye.
See you, man.